Thank you for coming in this morning, Mrs. Williams. I've told my colleague, Dr. Hutchinson, to respond to my pages so we won't have any interruptions. Would you like to invite your husband to join us?
No thanks, Doc. He's back at home. He doesn't handle these things well. I'd like to speak to you alone this time.
I completely understand, Mrs. Williams. We could always schedule a second visit with your husband at a later date if you wish. Before we talk about your test results, I wanted to ask you what you've been told about your medical situation so far. What is your understanding of the reasons we did the MRI?
Well, Doc, I haven't been feeling all that well over the last few weeks. I've had this nagging cough for a few weeks and I just can't shake it loose. My husband wanted me to get it checked out. He got me to quit smoking these darn cigarettes a while back. I guess I'm concerned that something real bad is going on. My mother died of lung cancer, and I guess I'm kind of scared, Doc. Scared that I have cancer just like my mother did.
I'm so sorry. How old was your mother when they found her cancer?
My mother was about 45 when they found it. I was in college at the time, and it hit me hard. I was close to my mother. She smoked 2 packs a day since she was 12 years old. I should have learned from that, but I was young and foolish. You never think it's going to happen to you. My mother didn't last too long. Back then, there were no drugs, and her cancer was far along, spread to her bones. She died 3 months later.
I'm very sorry for your loss, Mrs. Williams. You know, medicine has made great progress in finding and treating cancer in the last 20 years. We can find cancers very early and have powerful and effective treatments like surgery and chemotherapy. People can live long lives and are even cured of their cancer.
Doc, what did you find on my MRI? Is it bad?
We found something in your lung that's causing the cough. Would you like me to give you all the information or sketch out the results and spend more time discussing the treatment plan?
I think I'd like to hear it straight, Doc. I want to know what's wrong. If it's cancer, I want to know how bad and how much time I've got left.
Mrs. Williams, the MRI shows that you have a growth in the top part of your right lung. We won't know if it is cancer until we get a biopsy. But the good news is that if it is cancer, we will know exactly what we're dealing with and how to treat it. I think that you'll be glad to know that if it is cancer, there's absolutely no evidence that it has spread to the rest of your lungs. And the growth is in a position that we can surgically remove it and treat you with chemotherapy to get rid of the small cancer cells that we can't see. So, Mrs. Williams, I'm happy to tell you that your condition is both treatable and curable.
Thank you, Doc. I'm sorry I'm so emotional.
I understand how upsetting this is to you. It's very difficult for me also. You are lucky to have a wonderful husband, Mrs. Williams. I'm glad he made you come to see me right when you started feeling poorly. The good thing is that if it is cancer, we caught it early, and you have a very good chance of being cured.
So, what's next, Doc?
I would recommend we schedule a biopsy right away so we're absolutely sure what we're dealing with. I've already reviewed your MRI with Dr. Sloan, the interventional radiologist at Baptist Hospital. I refer all my patients to her because she is an expert at doing these biopsies. I would want her to take care of my family or myself if I needed the same procedure. Also, I know you prefer to go to Baptist because it's close to your home and most convenient for you and your family. I've already checked, and Dr. Sloan is available to do the biopsy on Monday or any time next week if that's okay with you and your family.
That's great, Doc. I want to get going on this and don't want to wait another minute. If it is cancer, I want it taken care of as soon as possible. I'm so worried I'm going to end up like my mother. I have a husband and 2 kids to support. How long do you think this will take and how much time off work will I need?
The results will take 2 to 3 days to come back. You'll need to take the rest of the day off from work and probably the next day if you could just to rest. You'll have some physical restrictions like heavy lifting so you don't overdo it after the biopsy. Other than that, you can return to work. The biopsy will rule out an infection and other types of non-cancerous growths. If it is one of those things, we can give you antibiotics or other specific treatments. If it is cancer, there's a good chance it can be cured because it's in an early stage. The next step is for you to see a cancer doctor or oncologist and a thoracic surgeon who specializes in surgically removing cancerous lung tumors. The two doctors usually work together. Depending on the type of cancer, the oncologist might choose to give you chemotherapy to shrink the size of the tumor before it's surgically removed, or after the surgery to get rid of small cancer cells left behind. If it is cancer, I'll refer you to my colleagues Dr. Perry, the Chief of Oncology at Baptist Hospital, and Dr. Pratt, a thoracic surgeon who's very experienced at removing these types of tumors. Dr. Perry and Dr. Pratt routinely work together and develop specific treatments tailored to each patient. They treat hundreds of patients with cancer and use the most up-to-date technology and medications. They will take good care of you. Of course, I will follow your progress during your treatment and assist in any way I can to assure you get the best treatment and continuity of care possible.
Thank you, Doc. When I came in here, I was so scared you were going to tell me that I had cancer and was going to die. I know I have a long road ahead, but at least I know I have a second chance at life.
Mrs. Williams, you have a very good chance at a complete cure. I know this is a lot to hear all at once. Please call me if you need anything or if you would like me to repeat any of what we discussed with your husband. I'll schedule a follow-up visit after the biopsy so we can discuss the results and plan the next steps.
Thanks, Doc. I'm sure my husband will want to speak to you. I'll make an appointment for us to see you on Friday and we will schedule the biopsy for Monday. I'm ready to get this taken care of. Oh, and by the way, no more cigarettes.
That's great, Mrs. Williams. I look forward to seeing you and your husband on Friday.